Hi guys, so today again we're going to be talking about tendinopathy, and today we're going to be talking more about treatment of tendinopathy and how you would go about approaching it if you're a runner who's currently having this problem. So last week we were talking about what tendinopathy is, and basically if you've got pain in your tendon, for example the Achilles tendon or the patella tendon, which is just on just below the kneecap there, or a hamstring tendon sort of just by the sort of sit bone or the gluteal tendon on the side of your hip, and it'll often be painful when you're running, and it'll go away when you're not doing anything. It's quite usually a local pain to the tendon. So if you've got local pain in your tendon, and it usually comes on with like loading, with running, then you're possibly suffering from tendinopathy, and this is how we would approach treating it. This is the kind of theory behind it. So back in the day when we were sort of first approaching tendinopathy, we talked about how it was used to be called tendinitis, and that was because it was believed that the tendon was inflamed, and if it was left alone, it would go through the natural healing process that things do. You know, through say if I sprain my ankle, there's a period of inflammation, and there's a period of what's called cell proliferation. It's kind of like scaffolding, and then there's cell remodeling, where you're sort of making the tissue back into a more useful kind of tissue, and that usually takes, you know, somewhere between 6 weeks and 6 months, right? And you get better, right? You sprain your ankle, leave it alone, it gets better. Tendons are not like that. If you leave them alone, the pain will tend to go away, but then when you try and start to do stuff again, it's not gone, it's not better. So say it takes someone with Achilles tendinopathy, and that's the example we're going to follow through because it's the easiest to think about. Your Achilles tendon is just down here by your heel. You know, if they stop running because their Achilles tendon is hurting, and then they leave it 6 months and take up running again, chances are the pain will come on even quicker when they run. It doesn't get better when you leave it alone. And so this was the sort of original thinking, right? We'll leave the tendon alone, the tendinitis will heal, it'll get better, it'll go away. Right? So this was sort of pre-1990s. But then some sort of research developed where they discovered that if you were doing sort of heavy loading exercises, what they call eccentrics, which is like putting a heavy load on your back and then doing calf raises where you kind of lower down and doing that repeatedly for a few weeks, that seemed to help. And then sort of subsequent to that, in the last few years, there's been more research done, and it's been discovered that, you know, you don't really need to focus on just the downwards loading. You can work on going up and down. And back in the day, it used to be thought that you had to load it into pain, but now it's sort of emerged that you don't have to make it painful when you're loading it, but you do have to load it because tendon seems to respond to loading. That seems to be the thing that makes it better. And I talk a lot more about this in the blog article that I've put a link to in the description to this video. So if you want a little bit more information on the kind of history of how tendon treatment is developed, go and check that out, and I'm going into that sort of process in a lot more detail. But what I'm going to get to is where we're at now and the way sort of I approach tendinopathy now, bearing in mind, you know, research as it is, you know, early 2018. What we know is that tendinopathy tends to get better when you do heavy loading, or when you load the tendon, it seems to respond in a favourable way by becoming stronger and more resilient and able to tolerate more in the future. So it's not rest that gets a tendon better, it's loading, okay? So in the case of the Achilles tendon, we could be talking about calf raises, right? So you stand on the edge of a step, you go up and down on your toes, you're using your calf muscle to pull you up. That loads the Achilles tendon, which is part of the calf muscle, and the Achilles tendon will respond to that load by adapting and becoming stronger and more resilient, so that when you try and run and place that load on it with running, it'll be able to tolerate that load. And that's the sort of mainstay of treatment as we stand right now. The trick is when you're doing your loading, right? So if you want to address your tendinopathy problem in your Achilles, there's a few things you have to bear in mind. One is that tendons are slow. Okay, they take a long time to get better. And most of the research is done on trials that last at least 6 weeks, and usually more like 12. And it's expected that tendinopathy, you're working on these loading exercises to address it, to get rid of it, you know, to make it so that you can run so much you can never feel the tendon. It's going to probably take 3 to 6 months, maybe even a bit more than that. And so you've got to kind of wrap your head around that, and that's the discussion I often have with runners when they have a tendinopathy that's quite mild is, is this bothering you enough for you to put the effort in to fix it, right? Because it's going to take, usually the programs I outline are like every other day or 3 times a week for like 3 months, 6 months, that kind of thing. You've got to be doing these calf raises with weights and stuff like that. And are you prepared to do that? Is this tendon thing bothering you enough to actually go ahead and do that? But let's presume it is, okay? And you do have this tendon problem that you want to get better, and you can accept that it's going to take a few months, probably at least 3 months to see significant progress. Now it'll be sort of progressively improving as you're going. It's not like you have to wait 3 months to see any improvement. And you can be running during that time, but it takes that long to kind of get rid of it, as it were. Now, so you've accepted that it's going to take a long time. We know that tendon loading is this treatment modality with the best evidence at the minute, better than any other technique. So we want to be thinking about some sort of exercise-based loading program. The question is, what do you do and when do you start? So if we stick with that example of the Achilles tendon, what I try and do is think how much load or what intensity of load can that tendon tolerate right now, and where would that sit on my little spectrum, okay? So I call this the tendon loading spectrum because we've got at the far end here, we've got fast loading, and that involves some sort of plyometric type stimulus, like running or jumping or bouncing, right? So it's a very fast contraction of the muscle and a very fast transmission of force through the tendon. So that's at the top end, that's very hard for the tendon to tolerate. And if you've got a tendinopathy, and say Achilles tendinopathy, you might feel alright when you walk, but if you try and hop on it, you'll feel it pretty quick often because of that increase in load. And that's why a lot of people with, say, Achilles tendinopathy are fine with walking around and stuff, but when they try and run and they use a faster loading strategy, then the symptoms start to come on, right? So coming down the spectrum, so that's the very top end, right? Plyometric type load. Coming down, we've got heavy slow. So this would be an example where you're loading the tendon with a very heavy weight, very large amount of sort of mass or load, but you're only moving the tendon slowly. So a good example of a heavy slow load would be doing calf raises, right, on the edge of a step, but with a big backpack on, which had like 40 or 50 pound dumbbells in it. And then you've got your body weight as well, so you're looking at sort of 250 pounds loaded through the tendon as you push up onto your toes and lower down, but you're doing it slowly. It's heavy but slow, right? So that comes below fast. So this stuff, even with body weight, will be more intense a stimulus for the tendon than heavy and slow, okay? Coming further down, getting into the lighter side of the tendon loading spectrum, I put light and slow. An example of that might be the same exercise without the backpack on. Right, so you're relatively light compared to a heavy load, and you're still moving up and down slowly, so the tendon is being loaded in a very slow way. Some activities that would fit with that would be like walking, swimming, cycling. These kinds of things are light, slow loads, and are usually tolerated better by the tendon. And then right at the bottom here, we've got static, and static is where the medical term is isometric. It means basically, if you think of my Achilles tendon, right, as I pull with my calf muscles, as I pull on my Achilles tendon, come up onto my toes, as I hold here, my tendon is being loaded, but I'm not moving. I'm not moving slowly, and I'm not moving fast, I'm not moving at all. I'm static. It's called an isometric load, or iso 1 metric length, like one length, like sitting still. And that's the easiest kind of load for a tendon to tolerate, okay? And so when someone comes in and says, I've got this problem with my Achilles tendon and it hurts right here, and they point to their Achilles tendon, so I'm pretty convinced it's likely to be an Achilles tendon problem. And then I'm going to say, what brings it on? When do you feel that? And they say, well, it hurts when I run, it hurts straight away. As soon as I try and run, it hurts. And I say, okay, well, what does it hurt when you walk? And no, it doesn't hurt when they walk, and it doesn't hurt at rest. So it doesn't hurt the rest of the time. But it does hurt when they try and run. And I know that running is a very fast type of loading for the Achilles tendon, right? So I'm going to say that they cannot tolerate fast loading. That tendon cannot tolerate it because it's painful when it does it. So it can't tolerate fast loading. it might be able to tolerate heavy slow loading, we don't know. And it can tolerate light slow loading because they said they can walk and it feels okay. So there's somewhere between here and here in what their tendon can tolerate. So I'm going to drop the guy in just there. And I'm going to say that this guy, this runner who's come to see me, sits here on my tendon loading spectrum. And then the treatment comes from where they find themselves on the spectrum. So what I do is I give them some heavy, slow loading exercises for the Achilles. I will give them a backpack with weights, stand them on the edge of a step, get them to do 3 sets of 15 because it's a good start. And a lot of research has been done on that at ski. And I give them a weight that's heavy enough that they can only just do 15. And they do the 3 sets and they do that every other day. And provided that the tendon doesn't hurt when they do it and they can tolerate it and they're strong enough to do it, they do that for a few weeks, and as it gets easier to do, we add more weight. And as that gets easier to do, we're sort of looking 4 or 5 weeks in, then we can start to try some faster loading and see if it can tolerate that. So what I often start with is like 20 seconds or 30 seconds just bouncing on the spot like that on 2 legs or just on 1 leg. So we start to slowly introduce the fast loading, but not too much. And during that time, we're probably not running too much if they can't tolerate it. So if their tendon pain is flared up as soon as they run, we know it can't tolerate any running. So we're working from here. And the idea is to increase the load tolerance of the tendon so that you can move the tolerance of the tendon higher up the loading spectrum until it goes beyond this end of it. And that's when you'll be able to run and stuff. Now you wouldn't bring it in like, oh, now I'm done, I can run as much as I want. It would be like a gradual thing where you start, if you can tolerate a bit of hopping and bouncing, you try running for a few minutes at a time, and then you gradually increase that, and increase that, and increase that, okay? So that's if somebody was to land here on the spectrum. Let me get rid of this guy. Now, say, when another man comes in, they said to me, my Achilles tendon hurts. They point right at the Achilles tendon. I say, when does this hurt? They say, it hurts when I walk. I can't run because it hurts far too much. It hurts when I go upstairs. It hurts when I'm just kind of walking around, day-to-day activities. Okay? I said, does it hurt when you sit down? They said, no. I said, does it hurt when you stand? When you're just standing still? No, it's okay when I'm standing still. It's as soon as I start to walk. And I said, okay, definitely can't tolerate fast loads. Running is out of the question. Heavy slow loads, they don't seem to be able to tolerate walking, so it's probably unlikely they can tolerate heavy slow loads. Light slow loads, even then, you know, walking is a relatively light slow load, and the tendon doesn't seem to be coping very well with that, okay? So they're kind of right down here, somewhere in between static and light slow, in terms of what they can tolerate. They can stand still, which is a static load, but they can't walk without pain, okay? So I'm going to drop that guy somewhere in here. And this guy obviously has a lot further to go, right? So that tendon is a lot more irritated, a lot more sensitive, and it's going to take a lot longer to get to that end of the spectrum where the running and stuff can happen without any symptoms. And we're going to start here, so we're going to give them some static loading to do. We're going to use the same exercise, right? Calf raises on the edge of a step, but instead of going up and down, we're just going to stay at the top. So we're just get our balance. You can stand on 1 foot, come up to the top and hold. And I'm going to get them to hold for a given amount of time. Common amount would be, 3 or 5 sets of 45 seconds hold. And when they can do that pretty well, I get them to do it with a backpack with weights on, or pushing on a wall so that they can push hard and the wall won't move, so we put more load on the tendon. Spend a week or 2 on that. Walking's comfortable now, so then we start light, slow. We do calf raises on the edge of the step. Just body weight only, 2 legs or 1 leg, whatever they can handle. Do that for a week or 2. It's getting better, heavy, slow. So we start loading up, putting some heavier weight on. Getting to the far end of heavy, slow. We start putting a ton of weight on, right? So they're getting very heavy, and that's when we start to introduce plyometrics, where we start to introduce some bouncing and things like that. As they get further into the bouncing, we start to bring in more running, which is a harder version of the bouncing in terms of it's a more intense plyometric load. So we sort of take them step by step, right up the continuum, or the spectrum, from one end to the other. And that's basically tendinopathy rehab in a nutshell, is I'm always sort of trying to work out where someone is. So if you're having trouble with your tendon at the minute, be it in your patella tendon, one of your hips, your Achilles. First off, try and work out where you are, okay? Can you walk without pain? Yes, then you're higher than this. Can you run without pain? No. Okay, you're probably around here. You want to be doing calf raises with a heavy load, going up and down. That being said, if you can't run without your Achilles tendon hurting, you probably want to go and see a physiotherapist to help get some guidance through this and to make sure that that is actually what's going on. But if you've seen a physio and they've got you doing some sort of loading program, this might help you determine where you are and how to progress yourself further to that end of the loading spectrum. Now, a lot of people can tolerate some fast load, but not a lot, right? And they shouldn't stop running. So say you get pain in your Achilles tendon, but it hurts after, say, 20k, but a 10k is okay. Then you don't want to do this stuff. Well, you do want to do this stuff to help build the strength in the tendon, but you don't want to do, you don't want to sort of neglect the running, because every time you take a step as you're running, you're loading your tendon. So it's going to be getting stronger as long as it's within the capacity of that tendon, right? So it's not making it sore, it will be making it stronger. So say you can do some fast loading, but not a lot, then you add in some heavy slow loading, which I'll talk about in a sec, and you increase the fast loading, the amount of running, slowly, but you don't do so much that irritates it. Okay, so you don't try and rest it away, you keep running if you can, but only to the amount that doesn't bring on the tendon symptoms. Lastly, the tendon, we think it adapts to something called time under tension, right? So we are always throwing in either some heavy slow or some light slow loading, always throwing in some calf raises, and we get people to do them very slowly, like 3 seconds up, 1, 2, 3, 3 seconds down, 1, 2, 3. The reasoning is that slowness causes strain in the tendon, and the tendon, we think, is adapting to that strain. That strain is the stimulus that causes the tendon to adapt and become stronger. So even if you can do some fast loading, in terms of running and stuff, that doesn't mean you don't do the heavy, slow stuff. So you would still do your heavy calf raises to build up the tendon strength, but you would keep running as well. Okay, so you don't miss this one out just because you're at this one. And then I think that's pretty much it, all of it. Okay, so tendons get better when you load them. You want to work out how much load they can tolerate currently, start loading at that amount, and try and increase it going further up the spectrum as your symptoms progress. Expect it to take a long time because tendons are slow. They will take usually sort of 3 to 6 months to rehabilitate fully, and that's normal. So you have to be patient with it, and if your tendon is only bothering you a little bit, you may find that you're not willing to put in that, those calf raises, 3 sets of 15, and then some bouncing exercises. And doing that, it'll take you 10-15 minutes every other day or 3 times a week for like 3 to 6 months, right? It's quite a big commitment. So sometimes you'll find your tendon is not getting better. It's just because you're not doing it consistently, long enough, heavy enough. And that's why a lot of tendon problems stick around for a long time, and what they really need is just to be pushed. And the person needs to understand that they have to commit to it for an extended period of time, but they don't have to rest during that time. They can keep running and that kind of thing as long as the tendon will tolerate it. Okay, that's everything I wanted to talk about today. Thank you.